We're good. So this is our program. This is Spaulding PM&R Residency. We have our three classes. The top left is our PGY4 class, and then Ray and I are both PGY3 chiefs, and we are in the bottom left. And then our brand new PGY2 class is front and center, and they're super great and super excited to be here. So, all right, let's do it. Basics. So we are an advanced program. So unlike other programs, we don't have a specific affiliated intern year. We are 3 years of PM&R. With that being said, a ton of our residents do choose, because Boston is in an area with so many hospitals and so many different intern year programs, a lot of our residents do choose to spend their intern year in Boston to get used to the area, to get used to the hospital systems in the area, before coming to Spaulding. Number of residents, so we do have 8 residents per class. We rotate at a bunch of different hospitals throughout our residency in the greater Boston area. In that, I would just like to highlight the VA. We have the West Roxbury VA, which is one of the larger VAs taking care of a large portion of the New England area. We do our spinal cord injury rotation there, as well as the Jamaica Plains VA. We do EMG there as a PGY4. We get a chance to rotate at Boston Children's Hospital, as well as Spaulding Cambridge, which is a Spaulding affiliated LTAC site, and many more outpatient satellite settings as well. Rotation. So we do a whole ton of things at Spaulding. We are so fortunate to be a part of the system because we have a traumatic brain injury, spinal cord injury, and uniquely a burn injury model system. So what that means for us is that we are really on the forefront of that research that's coming out, not only in those domains, but just all over the MGB network. We rotate in SCI, TBI, we have concussion rotations, stroke, medically complex rehab patients, burn injury, pediatrics, both inpatient and outpatient, sports medicine throughout all the years, and a bunch of different subdomains of sport. And we also have 4 months of elective that is spread over the course of PGY3 and PGY4 year. And we'll get into a little bit more of that later. And new as of last week, we are #2 rehab in the nation. So we really do benefit not only from the physicians who train us, but also the therapists, the nurses, all of the other staff that work so hard to make Spaulding great. Our program. So like a bunch of other programs, PGY2 year tends to be the heaviest inpatient year. We get 8 months of inpatient or PGY2 year. That's primarily at the Spaulding inpatient site. You can see that picture there. I love our Spaulding site. It's incredible. We get to spend a lot of time there as PGY2s, and because of that, we get really close to the other PGY2s in our class who are rotating there with us. We do have 4 months of outpatient. To break that up a little bit, we have a really unique outpatient neuro rehab rotation in which we do a lot of Botox, spasticity management, following up on those inpatient patients that we see. PGY3 year, that's where we get a lot of our EMG experience. We get 3 months of EMG to try to get those EMG numbers up, and we do get 2 months of elective incorporated into that as well. PGY4 is by far the most diverse as we begin to subspecialize to try to figure out what we want to do with the rest of our careers. It really allows for a lot of customization of our schedule. So not only do we have 2 elective months, we also have 1 selective month in which it's like an elective, but we do stay within the MGB system. The electives we have, we can go anywhere. We have had people in the past go out of state, go out of the country, do international rotations. You can do research rotations. It's really what you make of it. And our program director, our whole program really is very supportive in making our career aspirations happen. One unique thing about PGY4 year is that we focus a lot on residents becoming teachers. We are a very focus on mentorship and teaching. So our PGY4s have a month of dedicated teaching rotation time in which they come to Spaulding. They give lectures to our underclassmen residents and our medical students as the primary teacher of that month. And one thing that is new as of last year that we are continuing on this year because we thought it went so great the first time is that we have a junior-senior rotation. A great thing about being in a program where we have 8 residents is that we get a lot of one-on-one time with our attendings. On the flip side of that, having a junior senior rotation means that we have a PGY2 and a PGY4 paired together on an inpatient rotation for the entire month. As a PGY2, that gives you a senior to look up to kind of ask all the questions to really learn the ropes from PGY2 year. And then as a PGY4, you step into the role. The idea is basically to act as the attending of that rotation. You are taking the lead on things, you are running the show, and it's cool to rotate through a specialty that you already did with a new perspective and really learning how much you grew over the 3 years. Fellowships. We have a ton of fellowships here. Not only Spaulding affiliated fellowships, which include the sports, SCI, and TBI, amputee, and PEDS rehab fellowships. We also have affiliated pain and spine, as well as neuromuscular and palliative care fellowships within the MGB system. You can see on the right all of our fellowship match data from the past 3 years. We match all over the place. We've got a lot of pain, a lot of sports, but also things that are more unique, cancer rehab, and something to highlight, a fair number of our residents feel really comfortable with what they learn here. They feel ready to go into general practice after they leave here, which really is a testament to not only the breadth of our practice, but also the depth of it and how much people want to learn more about their subspecialties. Benefits and vacation time. So as of 2023, we are union represented we are very proud to say that our Spaulding PM&R program within the MGB union is almost at 100% resident representation. Those are our most updated salaries as of our most recent contract that was signed a couple months ago. So we have a very competitive salary compared to other programs. On top of that, we do get a $10,500 annual stipend that people can use for childcare, housing, or anything in between. We do get a 2% employer 401k contribution, very competitive health insurance, as well as educational stipends to be used for textbooks or question banks. In addition to the educational funds you see listed, every conference that you go to, up to 2 conferences as a PGY3 or PGY4, you get reimbursed an additional $500 if you are presenting. One of my favorite things about this program is how flexible our vacation is. I think PM&R in general is a really wellness forward specialty. So we take our wellness very seriously. We have 20 vacation days to use at our discretion. They don't need to be taken in 1-week blocks. They can be taken scattered throughout the year. In addition to those 20 vacation days, you also get 5 conference days and 5 personal days on top of it. So it's 30 days total, and there's a lot of flexibility. You don't need to find coverage. You don't need to call in backup. It's just you planning your vacation, and you really get the flexibility to do that. Call. So this is the view from our call room. Believe it or not, these are the views that we get to go to sleep to and wake up to every single call shift. Spaulding is amazing. So we do have 24-hour in-house call at Spaulding. We are a standalone inpatient rehab hospital, but like I mentioned earlier, there are so many hospitals in this area. And if you ever do need more support, if you think a patient needs a higher level of care, it is very easy to send a patient out to an acute hospital. It is in-house call, which means you get a post-call day, which is really nice in order to recover from the in-house calls. As a PGY2, you'll be doing a majority of your overnight call. Your first PGY2 call, you're paired up with a buddy, so you're not alone on your first call. Actually, you're never alone because there's always a chief resident on call that you can call if you're overnight and need some help. There's always an attending on call that you can reach out to. And our nursing staff, our nursing supervisors, everyone around is super helpful. It's really easy to switch call shifts if you need to switch anything for your schedule or any other needs. At the VA rotation, which you do as a PGY2, you do 1 week of home call, which is a little bit different. We also do have a short call system for late admissions, so it ensures that the day team is out by 5 p.m. every day, because there's another short call resident who comes in and takes those admissions that come in later.
All right, so here at Spaulding, we really do foster clinical learning throughout the residency. And so we have weekly didactics every Tuesday morning in which residents have protected time to really focus on learning. So our curriculum's on an annual cycle. We have guest lectures every week. We have hands-on ultrasound sessions, a board prep series annually that focuses on preparation for the SAEs, as well as a monthly quality improvement curriculum. So to go a little bit more in detail, we have attending-led lectures by wonderful faculty throughout the year. We have resident-led lectures that are led by PGY threes and fours. We have a really hands-on ultrasound curriculum for residents to really hone in on their ultrasound scanning skills. We have lectures that are led by both physical and occupational therapists. So, for example, to the right-hand side, if you see my cursor, we had a wonderful session this past fall in which residents had the opportunity to have an adaptive cycling workshop with our physical therapists. We also do board prep series throughout the year to focus on the SAEs that are conducted every January. We have a stat series throughout the year that helps residents hone in on stats skills to just overall help us become better clinician researchers. Have a QI, quality improvement curriculum throughout the year as well that meets monthly in didactics. And this culminates in group projects that we present to the whole hospital about different QI ideas we have throughout the year. And so you see here in this middle section, there was our picture at the end of last year's QI group project session. We have Journal Club that meets approximately every month during didactics as well, in which residents get to dissect a journal article and really tease apart the strengths of the article as well as parts of the article that maybe need some improvement, with the ultimate goal for our residents to become better academic readers and really hone in our clinical reasoning skills. And then finally have an annual anatomy week in which hosted every July, in which residents get to really hone in on their anatomy, physical exam skills, and overall MSK knowledge. So ultrasound curriculum, as I mentioned in the previous slide, our didactic days really focus on ultrasound skills. We focus on joints and specific joints and muscles every single session. These include the shoulder, the hip, the elbow, the wrist and hand, foot and ankle. There are also led by sports medicine fellows and attendings to really have their expert guidance as well. We have hands-on practice every session, as you can see on the right-hand side from the photos that we've had in the past. And this all culminates with the opportunity for residents to really practice their skills with the option to graduate with the MSK ultrasound distinction. And then also Anatomy Week. So we have this every year in July. On the top right, you can see our current PGY4 is having some class bonding with their PGY2s. So it's a really great opportunity for all of us to get together, spend time with one another, and really just learn together and hone in on our anatomy and physical exam skills. We have attendings, our sports med attendings who come in during Anatomy Week and really teach us anatomy and physical exam pearls. As you can see here, one of our attendings demonstrating the knee exam in the left-hand side here. We also have the opportunity to go to Harvard Medical School Anatomy Lab, the cadaver lab, and really refresh and hone in on our anatomy knowledge through the lab there in the middle section you see here. And also throughout Anatomy Week, we have the opportunity for residents to continue practicing their ultrasound skills through resident-led and instructor-led sessions as well. And so that goes back to our overall academic curriculum, really highlighting the opportunity for residents to really hone in on ultrasound skills. Because I think it's a really important skill for physiatrists to just get better at ultrasound and just really hone in on those skills in general. Other opportunities to grow academically outside of the usual workspace include the resident continuity clinic. And so we split the residency in half. We have clinic teams of 12 to 13 residents in which they meet every other Tuesday afternoon and they see patients focusing on post-discharge visits, TBI, stroke, Botox injections, MSK visits, as well as ultrasound guided injections. And they're a really great opportunity for residents to see patients that been discharged from inpatient rehab setting and just kind of follow up with them in the outpatient setting. And as Jen mentioned a little bit earlier, we really focus on really encourage residents to attend conferences every year as well, including but not limited to AAP and AAPM&R. with educational stipends for both those conferences and also extra funds for residents presenting at conferences during their PGY 3 and 4 years. In addition to national conferences across the country, Spaulding also hosts really great neuro rehab and sports medicine conferences every springtime. And as Jen mentioned earlier, we have 5 designated days off specifically for conferences. And in that bottom, you can see me with two of my co-residents at AAP this past spring.
This is a 5-minute reminder.
Thank you. And then, as Jen mentioned earlier, we really highlight wellness within the residency as well. Recent events include, but we're not limited to, a PGY2 welcome dinner, a kayaking trip, as you can see in that right-hand side, a darts session, you see here in the middle, bowling, Christmas gift wrapping, beach volleyball, happy hours, rock climbing, and even charcuterie nights. And then every June, we have the annual resident retreat in which residents are actually excused from all clinical responsibilities. And their past retreat this past June included an Orange Theory class, brunch, escape room session, and senior appreciation lunch. In addition to our formal wellness committee, as Jen mentioned earlier, we also have 5 personal days off per year for every resident, and no question asked for these personal days. Other extracurricular opportunities include ways for residents really hone in on possible future career pathways. For example, with regard to sports medicine opportunities, residents get the opportunity to really engage with marathon coverage, pre-participation physicals, and otherwise known as PPE. So, for example, we see here in the middle, this is a session in which residents were able to work with sports medicine fellows to do PPEs for Wellesley College students. Adaptive sports as well are also opportunities as well as sideline sports coverage. Volunteering opportunities include mentoring, food kitchens, community gardens, and local high school mentorship. Also a research track for residents interested in really pursuing research more during their clinical career. And then through this track, residents get predicted time away from clinical duties to really focus on their own research projects. And then finally, there's also opportunity for residents to spend some more time in the fluoro suite and do spine injections in the sim lab, as you can see here in the upper right-hand corner.
And we just have a few more pictures for everyone. We love our hospital so much. All of these pictures are from our Spaulding main campus, Spaulding inpatient site. In the top left, you see our therapy gym, and then the walkways around the therapy gym and around the hospital have putting greens and things for families and patients to do outside. Yeah, this is what our hospital looks like. And then some of the events that our residents have done together. So like I mentioned earlier, top right picture. So we do have our junior senior rotation, which is something we love. This is our most recent junior and senior pair. They got very close during the rotation, and there's a lot of mentorship here.
This is a 2-minute reminder.
All right, I think we just have one more. Boston's great. There's so many things to do, beaches and places to go skiing, snowboarding, hiking, nightlife, restaurants, everything. Boston's been great to us. So yeah, that's it. The next slide is our contact information in case anyone wants to email us any questions and follow us on Instagram. We also have our Spaulding PM&R residency program transparency statement if anyone wants to take a look at it. I know it's pretty small, but it'll be posted in our Instagram page as well as other communication.
Great. Thank you both so much. I believe we have 1 minute left and there is one question in the chat. And it says, thank you so much for your presentation. Could you briefly talk more about the structure of the research tract?
Yes, absolutely. So, Ray, do you want to take that one or do you want me to take it?
Sure, I can touch base on the research track. So basically, it's an opportunity for residents during when they come to Spaulding, they can declare their interest in doing more research during their time during residency, and you'll meet with potential research mentors, and then through that track, you'll be able to focus on more dedicated research projects and have protected time that you get to do those things outside of regular clinical duties. So, for example, some of these residents will actually have time to really focus on those projects instead of attend, for example, resident clinic. So, it's a great opportunity for those interested in research. We have really great mentors and opportunities for anyone to get plugged in whatever area of research they want to do.
Perfect. Thank you both so much. That ends our 20 minutes. And thank you for your presentation today. We very much appreciate it.
Awesome. Thank you so much. Have a good night, everyone.
Good night.